and welcome back to Inside the Heart of the Trenton Memorial Hospital Foundation. I am thrilled today to have the newest urologist that has joined the Quinte Health team with us today, Dr. Jeanette Johnstone. Welcome.
Thanks for having me.
Oh, we're so thrilled to have another urologist with us and a woman, which is fantastic. We kind of, I guess Dr. Woods let the cat out of the bag there last year that you were coming, so we had a little heads up. And we were very anxious to get to know you and welcome you to the Quinte region. How are you liking it here?
It's great. My family and I just moved here in July, so we're officially, now living in Belleville, working out of both Belleville and Trenton, and I couldn't be happier. The kids are adjusting well. It's going good.
So tell us a little bit about yourself. So where did you do your schooling and whatnot?
So I'm born and raised BC girl, so I was third of three girls and was raised just playing sports my whole life. I did university in California where I played soccer, and then eventually I met my husband that way in BC. We had a couple kids, and I did my medical school in BC, so that's where I became a doctor at UBC, and then chose to be trained in Kingston, which I'm a little biased, but I would say I have one of the best urology programs in Canada. So I've been in Kingston the last 5 years for my surgical training. Wonderful.
And yet you decided to still come here and join us at Quinte Health. That's fantastic.
Yeah, I'm now stuck in Ontario. I like it.
Good.
So here we are.
Good. Well, we're happy to have you. So tell us a little bit about what you do. You obviously have a practice, where you see patients out of the hospital, but you're in the hospital, and what are you doing while you're here?
So the practice is kind of a little bit of all of general urology. So I'm happy to see anyone with urologic issues. But surgically, most of the stuff that I really enjoy doing is stone disease and oncology. So I was brought onto the team to kind of help with the kidney cancer side of things. So I offer minimally invasive surgery with that. And then with stones, I always really love doing stone treatment as well. So we'll talk a bit more about that today too.
Okay, great. So are you working in the cystoscopy clinic as well?
Yeah, so I'm here doing cystoscopy, and that's for bladder cancer surveillance or diagnostic cystoscopy. That's out of the Trenton Hospital, and that's been great. And then I operate either here or Belleville once or twice a week.
Oh, that's wonderful. And the cystoscopy clinic actually is exclusive to Trenton Memorial Hospital. That's not something that is actually offered through Belleville.
No.
But it's been a great opportunity to be able to take some of the load off of Belleville, to be able to have those people come in, because some people have to use that clinic every 3 months.
Yes,
right?
exactly. Yeah. So some of our patients who have bladder cancer, their surveillance has to be every 3 months they have to come in. So it's really nice because having it in a hospital here, it's so easy for the patients to come in, get their procedure done, and get out of here in nice and efficient ways. So the patients really like coming here.
Oh, that's great. So some of the equipment that you do use, the green light laser, I believe. Something new coming that Dr. Woods was really pushing last year was the thulium laser. I believe that's in the works and should be coming shortly.
In the works. We're hoping for it to happen soon. We're currently working through a trial right now, looking at different companies and suppliers. But the thulium laser is a more powerful laser that's able to kind of take care of our stone disease a little bit more efficiently. So it's very exciting. And there's a lot of potential for other kind of functions of it as well.
Oh, that's wonderful. So the clinic actually itself, my understanding is that you could see anywhere from 10 to 15 patients a day. Is that true?
For the clinic, like cystoscopy?
For the cystoscopy clinic.
It's up to 35, I believe.
Oh, wow.
Yeah, so it can be busy. I've only just started my practice in August, so I'm still kind of seeing a few patients and just working about half days. But I think Dr. Woods and Dr. Guan will see 30 to 35 patients every time.
Wow.
Yeah, so it's busy, and they're all procedures.
So it's busy, and it must be very efficient.
Yes, it's very good. We have a great team over there that works well.
Oh, that's wonderful. Yeah. That's really good news. Well, it's nice to have those kinds of services here too, because it's a little easier for people to get in and out, as opposed to the larger hospital. So it's very efficient ambulatory service that we can offer our community, which is nice. Now, one of the things that we're needing, that we have had for several years, I believe it's 10 or 12 years old now, is the CArm.
Yes.
And that is something that both urology and orthopedics use in surgery. Can you explain a little bit about that piece of equipment?
Yeah, of course. So this is a really exciting part that's coming up, is that we're trying to get some fundraising for this new piece of equipment. So the CArm is used for X-ray. So it helps look at different things in the body. So orthopedic surgery does it a lot for their surgeries. They use it. For us, we do it a lot for stone disease. And it's fantastic. So the CArm is like a portable machine that helps locate the stones on the patient, and then we can safely provide surgery and operate with that guidance. So depending on the quality, it kind of reduces radiation exposure to the patient. It's a lot safer. It's efficient, and this is the way we kind of do our minimally invasive endourology stuff. So it's really exciting.
So just to keep it simple for those of us
Yeah,
that
of
are
course.
not in the medical world, your bladder stones, kidney stones.
Exactly. So it's kidney stones and bladder stones, as well as the stones that kind of are stuck in that tube in between the kidney and bladder. So any of those, which can be quite painful, and any of those patients out there that have had a kidney stone can tell you it's a surgery that's, you know, it's nice that it's offered urgently and that we can do it here. And obviously having the CArm makes that better for the patient, better for us, you know, easier surgery.
So it's like a mini x-ray, basically.
Yeah, exactly. It's like a portable x-ray machine where it kind of comes around. So it looks like a C, and you have the plate underneath and above, and it goes over the patient to do the shots.
So it's like real-time imagery right there.
Exactly, and the surgeon has the pedal. They can control it and be able to manage it and choose where it moves on the patient too. So the actual x-ray is not getting that whole body. You know, we're trying to minimize our radiation exposure on patients, people in the room, so it can target just a specific area. So you can look at just where that stone is, that kidney stone is, and just keep an eye on that without having x-ray everything else on the body.
So the CArm, from my understanding, is worth about $250,000.
Yes.
Which is something
a pretty penny.
Yes, it's a very expensive piece of equipment that we're hoping our gala, the Boots and Bling Gala.
Yes.
Hence, you're probably wondering about the boots and the hat. The Boots and Bling Gala is happening on Saturday, November 4th. And we're hoping to raise all that money that you need for that CArm.
Yeah, that would be amazing.
Generosity.